Welcome to Keto Life Support, where we make your keto life sustainable, fun, and low stress. I'm Kim Howerton, and I'll be coming to you weekly with some of my keto besties to bring you the practical, real-world keto advice that you need. Quick disclaimer, I am not a doctor, and even if we do have a doctor in the house from time to time, he or she is not your doctor, and nothing we say on this show should be taken as medical advice. Always check in with a trusted medical professional about your own personal medical concerns. Hello and welcome to Keto Life Support. This is Kim Howerton, and today I'm coming to you with an episode with Dr. Ken Berry. This should be episode number 69, and Dr. Ken Berry and I had a nice chat. If you remember from a few shows back, I was in Tennessee for a bit, sat down with Ken and Nisha at different times and had chats. And this one, Dr. Berry and I were going to talk about a bunch of different blood work topics, but then he just started asking me questions because he does that. He doesn't let you interview him as much as he interviews you. And we started talking about my experience with being hypothyroid and my diagnosis and my misdiagnosis and depression. And we just got off on a roll. So pretty much this is just me talking. I felt a little vulnerable, but I think it's good. And he assured me that people would get a lot out of this if I put it out there. And so I am. So I hope it works out for you to listen to this. I'm sorry if the sound gets a little wonky. I don't have super fancy recording equipment, and I was in person with them, and Dr. Berry is very loud. I am also very loud, but I'm more shrill. He is very loud in sort of a deep, resonant way. So sound levels might be a little bit off. So I hope you still enjoy the conversation. Take care, and I will see you next week. I am here with Ken Berry on Keto Life Support Podcast. And how are you doing, Ken?
I'm doing great. Good to see you again, Kim Howerton.
Good to see you. So we're very excited to be recording this together in person here in Tennessee.
That's right.
So what have we been talking about while I've been here? We've been talking a little bit about blood labs.
Yeah, we're talking all about lab work, both blood and urine, the ones you need, what they mean, which ones to ask for, how to ask for them, how to ensure that your doctor actually orders the lab work you need in order to have a full picture of your overall metabolic health.
Right. I mean, for me, like a huge part of my story is that I was not diagnosed with hypothyroidism when I was diagnosed with depression. And then that depression diagnosis got upgraded to bipolar, which felt like it didn't fit at all. But when you put the symptoms together, it sort of felt like, well, maybe, because sometimes I was a little better and sometimes I was a little worse, and it was pretty extreme. And I got put on some really significant psychiatric meds. Oh, see, but I already gave the story away, which is later, it turns out nobody had ever tested my thyroid. I was hypothyroid, which pretty much was causing, if not all, but a lot of the things I was dealing with on my depression journey.
Yep. And so let's break that apart. Let's talk about that because that's hugely important. There are millions of people around the world with undiagnosed hypothyroidism who have the full list of symptoms, which can include depression and bipolar-like symptoms. Doesn't mean you have clinical depression. It means you have hypothyroid with one of the symptoms being depression.
Right. Or just as a thing, you might still have depression, but you'll never get your depression under control if your hypothyroidism is running rampant.
Correct. So let's just take your case and let's just run with that. And for everybody listening, there are so many people who think they have depression or think they have fibromyalgia or chronic fatigue syndrome or just cannot lose weight or any number of other symptoms or conditions. And they think that's their problem.
Right.
When in reality, their problem is they have undiagnosed hypothyroidism. Or low thyroid.
Underdiagnosed.
Or under, that's exactly right. So I imagine when you first went to your doctor with your list of symptoms, did you get any lab work at all before your depression diagnosis? Or did you they talk to you and said, oh, you've got depression, here's an antidepressant?
The symptoms started manifesting when I was 9 years old. nary a blood test was drawn in response to that.
Right. And you can give the doctors a little bit of leeway on that because it does suck to have to put a needle in the arm of a 9-year-old.
Right.
Lab techs don't like it. The nurses have to hold the 9-year-old off and hold them still. Nobody enjoys that. But in order to do a good job as a doctor, sometimes you have to do things that the patient would rather you didn't do. I mean, none of us enjoy having a needle pierced into the wall of our vein. Nobody likes that. But in order to do a good job as a doctor, that often is mandatory. You have to know the lab work in order to make the diagnosis. So there are many diagnoses like depression, which are called diagnoses of exclusion. And what that means is when a doctor talks to you and interviews you and says, oh, you have depression, that means that doctor did not do that properly. That is not how you diagnose depression properly. You have to rule out all of the other medical conditions that could have depression as one of the symptoms of that condition. And one of the most common undiagnosed medical problems that can have depression symptoms is hypothyroidism. And so if at 9 years old, your mom and the nurse had held you down and the lab tech drew your blood and checked the proper thyroid labs, you would never have had to went down the false diagnosis road of depression and even bipolar because, first of all, you're taking unnecessary medications, some of which can have egregious side effects. And luckily you didn't have any of the terrible side effects.
Additional 40 pounds.
Right. Weight gain, yes. But I mean, there are life-threatening side effects from some of the antidepressants and definitely from the bipolar medications. You can have disastrous side effects from those. And luckily you didn't have those. So if that had happened when you were 9, you wouldn't have went through your entire adolescence and teenage years thinking that you have this mental health disorder.
Right, yeah.
Think about how your life would be different. Think about that.
Right.
Because, in modern society, we're trying to destigmatize mental health. But I think on your podcast, I can speak freely.
Please do.
There's always a stigma.
Well, even internally.
Your own stigma, and then if you happen to share your diagnosis with anybody else, regardless of how much they love you, how much they respect you, there's still that stigma, that little bit of judgment, that little bit of standoffishness, like, don't say that to Kim, she's got depression, kid gloves, all the things that go along with that.
Or there was a normalization of feeling bad.
Yeah.
Because with depression, right, it's just like, well, we'll try and give you some medications, but we kind of know that most of the even if it truly is depression, all the medications only sort of work.
They help a little for a while.
And then, we've got the problem that essentially the diagnosis of depression to most people is essentially saying it's time to just accept that your life is going to suck.
Yeah. Somehow your brain is broken. Your brain is deficient. You're not making some neurotransmitter or your neurotransmitters are mucked up. The only hope for you is to take a pill and keep trying pills until
a lot of therapy.
A lot of therapy, hopefully some therapy, but mainly just the pills, right? Just the pills.
Right. Well, and there's a way that it's really insidious, right? If they know you have a condition and you're just probably not going to feel as good as a lot of people feel, you kind of stop looking for the reason you feel so bad because you think you know the reason you feel so bad.
You've stopped looking for the real answer because you think you found the real answer.
Right.
And then now let's think about every subsequent healthcare provider who saw you in all those years. You had depression on your diagnosis list. So they immediately, if you complained of fatigue or lack of motivation or weight gain, they immediately had something to blame it on. They didn't have to dig deeper because it's like, oh, she's got depression and she's on this antidepressant, which has weight gain as a side effect. So of course she's depressed. And of course she has no energy and no motivation, no drive, and she's gaining weight. It all makes perfect sense. But they didn't even think to dig deeper and look for hypothyroidism because they already had a diagnosis in the chart that explained it all.
Totally. And then when I got to college and the symptoms got worse, instead of going to, well, what is it fresh? Well, then it must be bipolar, right? If it's what's worse than depression?
Right,
bipolar.
right. And it's very common for someone with a diagnosis of depression, whether it's rightly or wrongly given, for them to progress, in air quotes, to bipolar or something because there's been a new drug rep in the doctor's office talking about this new medication, and it's FDA approved for bipolar disorder, but it really helps people with depression too. And so all of a sudden now you've got this second diagnosis, or this actually more impactful, more stigmatizing in some areas, diagnosis of bipolar disorder. And now not only are you depressed, but you may be a little crazy.
Totally.
Right? Because that's how many people, many laymen, if they hear somebody's got bipolar, they're like, "Ooh, don't turn your back on Kim. She might stab you. You don't know." Right? And so all this baggage you've had to carry your entire life, you're really amazing that you have accomplished all you have, and you are who you are, having to carry all that crap with you for all these decades. Not like there's a lot of decades, but you know what I'm saying.
There are a few decades. But yeah, I mean, it was, I think that the diagnosis in college was really rough on me because, yeah, it did. It felt, I mean, and no stigma to the people that are bipolar. I mean, a lot of my family is bipolar, which actually kind of influenced their diagnosis.
Right.
It's genetic.
Right.
But it was like, oh, if I'm already here at 20, like what comes next and what's going on? And why don't I still feel good? And why don't any of these medications work? Like I was on a lot of different medications. They didn't touch any of it.
And again, before you were diagnosed with bipolar disorder, did you have any lab work checked? Or was that, again, a diagnosis of just history and physical with no labs?
No labs.
Again, another diagnosis of exclusion. 100% of the time, no doctor should ever diagnose somebody with depression or bipolar disorder without ordering a full panel of relevant, meaningful lab work to rule out medical conditions that can mimic those psychiatric conditions.
There is a little interesting caveat to this. It's like, this feels like watching one of those horror movies where like things almost go right, but they don't. Which is when I was in college, not the doctors that diagnosed the bipolar. There was one point at which I was a nanny for an OBGYN, and her boyfriend was a psychiatrist. And he said to me, "Hey, I've actually been finding that some people with your kind of symptoms have thyroid problems. You should get your thyroid checked." And I did.
So this wasn't a doctor who was fiduciarily required to do the lab work. This was just a friend of a friend saying, "Hey, you should get your thyroid checked." You see how terribly that speaks to modern medical practice.
Totally. And I did get my thyroid checked, but not in the diagnosis. I told my OBGYN, "Hey, can you run these labs for me?" And they said, "Oh yeah, they're fine." They did, but I don't know.
And we'll get into that in a minute.
Yeah, we'll get into it. Like, in hindsight, I don't know which lab. But they were like, "I don't know, your thyroid's fine."
Yep, exactly.
So it was like a missed opportunity.
Yeah, a huge missed opportunity to save you from thousands of dollars in copays, years of the stigma, unjustified stigma, but stigma nonetheless, and then also your own self-judgment, your inner voice, all those things, all the things that you've had to carry for all these years.
And not to mention, I can, like, in hindsight, I'm like, I could have lived with depression but the main problem for me is the thing that was wrong. I mean, I'm willing to acknowledge that I may actually have a separate diagnosis of depression.
Possible.
But all the while, everything was attributed to the depression. And I was getting sicker and sicker and sicker over decades of being undiagnosed with the thing that needed to get diagnosed.
Yes, when you were 9 years old. From
the time I believe I was 9 years old, the doctor that finally diagnosed me with hypothyroidism was like, "It's clear you've been hypothyroid at least since your teens." And I have to imagine it was probably since that, about 9.
Yep. And it's usually about when puberty starts to start.
And I started puberty at 9.
Yeah, there you go. So that makes perfect sense. So when your OBGYN did check some lab work for thyroid, what they probably checked was a TSH, or a thyroid stimulating hormone, which is a hormone that's excreted by the anterior pituitary gland in your brain. It's not actually a thyroid hormone. And they probably checked a free T4, but they maybe didn't, because many, many doctors think that the TSH test is the end all be all for the thyroid, that if there's anything wrong with the thyroid, the TSH will be abnormal. And you and I both know that is not true.
Right.
You can have a perfectly normal TSH level and have out of control hypothyroidism or autoimmune thyroiditis.
Mm-hmm. Absolutely, yeah. And the other thing that I struggled with was, even the doctor was like, well, it may be out of range. Oh, gosh, it's like coming back to me. The doctor was like, well, it may be out of range. Let's get you another test. Like, let's retest it, because I want to be sure. And so the first test may actually have been out of range. I took 2 thyroid tests. The second lab said, oh, no, it's fine.
Yep.
Now, in hindsight, I'm like, well, how do you know that the out of range one was wrong and the in range one was right versus the opposite? Or what I've now learned, if they were just testing TSH, it can vary from day to day.
Day to day, absolutely.
Minute to minute.
Yep. And so probably, I bet the first time they checked the TSH. And the TSH was probably a little bit high. And another thing that all the listeners should know is that many, many primary care doctors, and that would include pediatricians, family doctors, internal medicine doctors, are very uncomfortable diagnosing and treating thyroid conditions. They shouldn't be. They should be very good at it because it's so common, but they're not very good at it. And so even when they see a TSH that's mildly elevated, very often they'll say, that's probably fine. She looks pretty normal, even though you felt miserable every day. You didn't look sick, right? Because you were young and healthy. And so they didn't want to put that diagnosis on you. They didn't hesitate to put the depression and the bipolar on you, but they didn't want to put hypothyroidism on you. So they're like, well, let's recheck. And so probably the second round of labs was a TSH repeat, and then a free or a total T4. And what I would guess is that the second test, the TSH was even higher. And they're like, well, gosh, 2 high TSHs in a row, there may be something here. Did you get a referral to endocrinology, or did they take it from there?
No. So they tested both of those tests. I didn't get a referral anywhere. It was just, they said, well, can you go back and get some more blood drawn? We'll do this. And then they called me and said, oh, no, everything's fine.
Everything's fine. Okay. All right. Yeah. And so one of the key take-home messages people should get out of this is that just checking a TSH or just checking a TSH and a free T4 is not an adequate thyroid panel. That is not a complete thyroid panel. You can miss very many things with that, which we'll talk about.
Yeah. And so I kind of put that out of my head for a lot of years. And so that was when I was...
So you just kept living with your bipolar, taking your meds?
No. By the time I was done with college, I was like, screw these meds.
Okay, good.
I was like, nothing is working. Yep. I did at one point, when I did know enough that they warned me, one of the meds they had me on was a serious, like, you can't just stop taking it. You get you could have like a heart attack. Like it was some, I actually know it was like welts. There was some like horrible thing they promised if I did. So I weaned off the last drug with their help. And then I was just like, screw this. None of these meds have done a single thing. I'm just going to be without them.
Yeah. And I can't blame you for that, because all the ones you were taking, they weren't helping you.
No, not at all. But yeah, except for the one that I did gain 40 pounds in around 2 months. That did something.
Wow. Yeah, it did something, but nothing positive, nothing good.
Yeah.
And you still, even while you were gaining the weight, you were still having your quote unquote bipolar symptoms.
Oh, yeah. It wasn't until my late 30s. So like 15, 18 years later, that I was like, I really messed up somehow. I was like, I'm in a health spiral. Now, here's the problem that people might identify with. When you have depression issues and weight problems, and I knew I had PCOS by then. I was diagnosed with that at 15. Nobody said a boo about insulin all along, but
right.
So I knew I had PCOS. I knew I had depression. I knew I had weight problems. I knew I had an eating disorder. I just felt sort of like a hysterical woman.
Mm-hmm.
I felt like all of these things are probably due to the fact
Yep.
that I cannot control who I am, how I
Yep.
eat, what I do.
Yep.
But I did.
And you were so horribly diagnosed and horribly mismanaged.
Yeah.
How could you not feel like this is in some way I'm deficient, I'm crazy, there's something wrong with me? Ever once did you question the doctor's authority, not their authority, but their ability? Did you ever be like, you just trusted the doctors? Like, okay, I'll try this new pill.
It didn't. I was like, because I would hear, you hear people occasionally say like, a good portion of the population is just not responsive to psych drug stuff. And I was like, I guess I'm one of those people.
Yeah. One of those people who's misdiagnosed.
Right. Yeah. But, there were just so many years where every single thought I had about how bad I felt would just come back to, well, I'm fat. Well, I eat too much. Well, I like junk food. And it would just always spin back, I don't exercise.
It's all your fault.
It was all my fault.
Yeah, all your fault.
Yeah.
Yeah, yeah. And nobody ever said that to you. But that was definitely the feeling that you took away from all this.
Oh, yeah. Yeah.
Looking back now, do you have any animosity or anger?
Actually, I don't specifically, because I really do feel like all of the doctors I saw, when I think, remember them, I do think that they wanted the best for me.
Mm-hmm.
I don't think they were angry or pissed off or, I didn't feel like they were directly blaming me. At the same time, I really think they were just not well educated about these topics.
Mm-hmm.
I mean, they were very well educated, Harvard and, very fancy degrees on their wall.
Yeah. You established very early in life that a Harvard degree doesn't mean that you're going to get diagnosed properly.
Absolutely. And so compared to 90% of the people in the world, their story I hear about misdiagnosis, I feel less angry about mine than theirs. Yeah. Because in my case, I just feel like these people had no idea that insulin and thyroid and what the actual right diagnosis was. And
I think you're exactly right. I think I don't know your healthcare providers, but I can predict that every single one of them was well-intentioned, well-educated, had nothing but the best of intentions with their management protocol for you. They believed you and they believed in their diagnosis. I don't think there was any ill will. I don't think there was any, and it's, looking back, obviously you were misdiagnosed, but it's even at this point hard to look back and say there was negligence, isn't there?
Yeah. I mean, and given, I could see, given my family history,
right.
Given my symptoms, but it's but when we look at the fact that you're never supposed, there's a rule, right? You're not supposed to diagnose depression without doing these tests.
Right.
Well, would it have been caught? Maybe, maybe not. But it wasn't even a question of doing those tests when I was diagnosed. Right,
exactly. And yeah, it's just really hard to place blame on them, even though it was their job.
Right.
They were licensed healthcare providers. It's still hard, even for me, to look upon them negatively. Right. It's so easy to say, well, they just didn't know better.
Right. And I honestly think that, I think that doctors have, just like every profession, right? You have a responsibility to stay up on your stuff.
Yep.
And this was in the 90s.
Yeah.
And I don't know that this stuff was being discussed as much as it needed to be.
Well, definitely the insulin issue was not being discussed, but depression being a diagnosis of exclusion was absolutely, that was on the menu. Yeah. Now, maybe this particular doctor, that hadn't resonated with them, but that absolutely was being taught back in the 90s and 2000s. So, yeah. But I applaud you for not having ill will, hard feelings, even though you were severely mistreated.
Yeah. And, it was in my late 30s that I finally, there was this doctor who was kind of up and coming, she was a well-established doctor, and she was Harvard trained as well. But she was like on the forefront of hormones, and like she was writing books. She was kind of a celeb doctor, and she was in my area. And I thought, I think this will be worth the money. She was expensive to go and see. Like literally, this was my birthday, Christmas present. Like I asked my folks, I was like, hey, would you save up all my presents for a visit?
So I'm taking it that she did not take insurance.
She did not indeed take insurance.
And oftentimes I see doctors on social media really looking down on doctors who don't take private insurance or Medicare or Medicaid. But very often those are the doctors who are thinking outside of the box enough to actually catch a misdiagnosis like this. And so I wish that they didn't charge so much, but sometimes it's worth all the birthday money and the Christmas money.
Was. And like it was a time in my life where, I mean, and this is unfortunate as well, right? When you're managing a chronic illness, sometimes you're not as well employed as you should be.
100%.
So I was like, my whole life was being really held back by how much energy I had to waste on functioning. And so I went to see her, and she immediately diagnosed me as hypothyroid.
Yeah.
She was like, she was like, I think you're hypothyroid.
She looked at you from across the room. Yeah, because she had thyroid on her radar, and immediately she saw your hair. It was thin.
Eyebrows.
She saw your eyebrows.
Yeah.
She saw just your demeanor.
Yeah.
And a doctor who's cognizant of the hypothyroid and what it can do to a patient, we can almost spot somebody across the room at a restaurant and be like, I've wanted to go over to the other side and say, have you had your thyroid checked? But Nisha always vetoes me. She's like, no, it's not your job. Just enjoy your dinner.
Right. So yeah, she said that, and then she sent me for labs, and she sent me for a complete panel of
Perfect.
labs.
Yes.
And she came back, and she said, she was saying, I think that you have a problem converting T4 to T3.
Yes.
Based on your labs.
Yes. So you had an elevated reverse T3.
Yes.
Yeah. So you had plenty of T4, but the actual active thyroid hormone in the body is T3.
Well, interestingly, she said, because she said your T4 is still a little low.
Gotcha.
So I didn't have plenty, but it was sort of there were multiple problems. Yeah.
But there is a subset of people with hypothyroid symptoms who don't convert T4 to T3 properly. They actually make reverse T3 instead of usable T3, and it's an enantiomer. So it's like your left hand and your right hand. They resemble each other, but they don't overlap. And so it didn't fit into the receptor properly. Therefore, you effectively had no active T3 in your body, severely hypothyroid for all these years. And that was the problem.
Right.
And it took one lab panel and one doctor who understood hypothyroidism, and you got your diagnosis that you should have got at 9 years old, or 13, or 18, or 21. You got it at what age?
38, I think. So 29 years later.
29 years later, after you had suffered, you got your diagnosis.
Yeah. And since then, it took about a year of active work to dial in my appropriate dose. But once we did that, I started feeling better right away. Right. But she kept being like, no, I think we could do better. Like she wanted me to be as optimized as possible.
And that's a key concept. We should talk about that. The difference between just getting by and being optimal. Because I think most people want to be optimal.
Right.
But many doctors are happy if you're just functional.
Right. Yeah. Because I see a lot of people, because now I have clients who are hypothyroid. A lot of my clients are hypothyroid because a lot of people are hypothyroid. And I see people who are like, well, I'm better. Well, I'm not exhausted. Well, then half of my hair came back. It's like these things that are, but are you optimal? And you can keep pushing to get there. But it's I think perfecting your thyroid supplementation is an art, not a science. It's not just a number. It's a number and a feeling.
Yes. And when we say something's an art, we don't mean that there's no science involved.
Right, totally.
The science is absolutely there. We as providers just don't understand it yet. And so that's where the art and somebody like that doctor at 38 years of age being aware of what hypothyroid can do to a patient and looking for physical signs, just as she's saying hello and shaking your hand, looking you up and down, going, oh, wow, check the box on hair, check the box on eyebrows, check the box on weight, check the box on just her overall demeanor. That's the art of medicine, but that absolutely is backed up in the science.
Totally.
And 50 years from now, when we understand all the science, we'll be able to look back and say, this is why Kim's hair got so thin. This is why the outer third of her eyebrows got so thin. This is why you gain weight so easily. Some of the answers we know now, but some we have no idea why that happens.
Right. It's interesting, yeah. And then the second part of the amazing thing that I interacted with this doctor about was she said, you're going to need to change your diet. And it wasn't eat less. It wasn't move more. It wasn't you need to lose weight. Although I wanted to lose weight because at that point I was very overweight at that point. It was no more grains for you. I remember her saying, like, you can't have grains are not, especially with thyroid problems. Yeah. Grains are not your friend. Yeah. And she basically, she wasn't keto, but she basically was telling me that I had to go low carb and that there were certain foods that were just not on the menu anymore.
Yeah, that's awesome. Yeah. And we're definitely not going to name the docs in your past who misdiagnosed you, but do you want to give a shout out?
Sure. It's Sarah Gottfried.
Yeah.
Who has written a few books. She's a little bit keto. She's not fully keto. Yeah. I don't agree with her about every single thing, but she was a solid doctor.
Yes.
And she has a book she has a couple books. I'll put them in the show notes, but it's like, I think there's 3 books, all on like hormones, aging, things like that. So
yeah. So kudos to her.
She was great.
Yeah. She changed her life.
She definitely did. And she also gave me hope, for the fact that, because it's when you live with a chronic illness, but you don't know that you have a chronic illness or you don't know what the chronic illness is. It's hard.
I think it's very important that you said she gave me hope.
Yeah.
She also gave you a path and she gave you a plan. Whereas from 9 years to 38 years, you were in the dark, not only with the misdiagnosis, but did anyone ever say, hey, your diet may be important. Hey, maybe, maybe you should try these supplements. Maybe you weren't ever given hope. You weren't ever given a plan. You were just like, well, we'll try this new pill. It just came out.
Well, yeah, the only thing anyone ever had mentioned to me, I mean, it was in my chart with my doctor from the time I was, how old was I? Yeah, from the time I was like 9 or 10, that same time period, because I was heavy by then, that I had a weight problem. I remember picking up my chart for summer camp and it said obese, and I was devastated.
How old were you then?
I was probably 10.
10. And you saw that you were diagnosed with obesity.
I drove up, was like, go run upstairs, pick up your chart. And of course I opened it.
Sure.
And it said, obese.
Yeah.
Just like in very large letters on.
Do you remember how that made you feel?
I was hysterically, like I was in tears and I was just devastated. And I couldn't let it go. Like it was, it's weird because it wasn't like I didn't know.
Right.
But to see it in writing,
black and white,
was very.
Even the doctor thinks you're fat.
Yeah. And that it was important enough to put it front and center on my chart. It wasn't like on a page. It was like, it was a label on my chart that described me.
Yep.
And so it wasn't like it was a surprise to me that, because at that time I knew that how you ate affected what you weighed. Now I thought it was how much you ate, not anything else. But like I knew that I liked food a lot, and I knew that I ate a lot, and I knew that was probably not good. And so like I knew things that I thought I knew.
But you thought it was how much you liked food. That was the bad part of you. That was bad of you to like food that much. And it was bad of you to eat as much food as you wanted.
Yes.
Yeah.
Yeah. And so that was always what I went back to when I was trying to fix what was wrong with me. And then, of course, it's a feedback loop, right? That like you have depression issues, you don't like yourself, you feel bad about your weight, you get more depressed, so on and so forth. And so whenever I would feel worse, I would always have something to blame it on.
Yeah, sure. You had a built-in list, and it was in your medical chart.
Indeed.
You could blame it all on that. Yeah.
Indeed.
How do you think? And it feels like I'm interviewing you.
I know.
How do you think? Because I think this is important for the listeners to really understand that this is not just them. This is not their fault. This is not just their problem. How do you think your life would be different if you had been diagnosed properly at 9 or 10 or 11 years old with hypothyroidism? And how would your life be different if you had seen Dr. Gottfried when you were 9?
Well, I mean, the first thing I want to say, just because of who I am, is like, I'm really happy with my life at this point.
Of course.
Part of who I am is what I've gone through.
That's true. And such a healthy way to look at it.
Right? You'd think I was a coach or something. But at the same time, I remember just having a miserable childhood and constantly not understanding why. Because my parents loved me. I had friends. I wasn't unpopular. I did okay in school. And I just remember being constantly miserable and constantly sort of feeling ungrateful. Like, what's wrong with me that I can't be happy? And I think, and then there's things like, I wanted to be an actress when I was a kid. I started taking drama classes when I was 7. Like, I forced my mom to put me in theater, and I did all these things, and I eventually stopped because I couldn't handle the criticism and the not fitting in. Like, my skin was a little thin, and then I was dealing with so many health and weight problems, meant I didn't necessarily fit into the mold of what I thought an actress should be like. Yeah,
because the key things that every girl wants to be right. Your hair, your skin, your weight, things that most people take for granted if you're going to be an actress.
Right.
And of course there are exceptions, but on average, those things have to be right.
Right. And they were not right according to, what they were supposed to be like. And so I decided, like, I saw actors who were heavy or did something else, and I knew my skin wasn't thick enough.
Because of the abuse they had to withstand and the reviews and the comments and the...
And I thought, I don't want to deal with that. I don't. But it was something that I can tell you, up until my 30s, I would go to the theater to see a play, and I would sit in the audience and I would cry.
Being an actress was your dream.
Yeah. Dr. Barry's making me cry. Yeah, it was. And like I said, I'm super happy with my life now. I love what I do. I love what I get to do. But there was a lot of mourning. Yeah. About the life that I wanted that I didn't have.
Yeah. And I think that way too many women and a few men suffer from that because they've been misdiagnosed. Their hypothyroidism has been missed by their doctor. And that's not okay. It's not okay that your dream was taken away from you.
Yeah, and I'm good with a lot of things, and there are a lot of things about my health even today. Like, it's like when you, what do they say? Like, it's like you have a problem, your car breaks down. Right? Your car breaks down. I think Dr. Fung gave this example, so I'm trying to remember, but it's like you're driving your car and suddenly the thing that goes around that makes the car go. What's that?
The motor.
A belt.
Belt
breaks in the engine.
Yeah.
And if you'd caught that belt when it was worn out and you replaced it, you just have to replace the belt.
Right.
But if you don't catch it and that belt actually breaks, it destroys the whole engine. Because when the belt breaks and it just whips around and whacks into all the things in there, now you need a completely new engine instead of just replacing a belt. And there are a lot of health things that I now deal with that can't be reversed.
Because so healthcare providers refer to the thyroid very often as the master gland, right? And it is in many respects the master gland. The true master is probably the pituitary, but the thyroid plays such a prominent role in the development, in your body habitus, in your mental health. And so your belt broke when you were 9 years old, but you know, the thing about human beings is you can't put a new motor in,
right?
We can't do that, and so your metabolism, its master gland, was malfunctioning for 29 years before it was diagnosed. Oh my God, your master gland is not working properly. So, of course, there's going to be some long-term metabolic health ramifications from that. And that's what you're talking about. You're still stuck with these things that still, even though you're doing everything right, your metabolism still won't behave as it should because your master gland was broken and malfunctioning for almost 30 years.
Right. And then it's, little things, but they matter. Like when you deprive your hair, like when the follicles give up the ghost, you don't get them back.
That's right. After 30 years of hypothyroidism, you're going to have some permanent follicular loss.
Yeah. And
so even if you do everything right now, you'll never have the head of hair you could have had. Because I'm guessing as a 7-8-year-old child, you had a mop, didn't you? You had a head of hair.
I had a lot of black hair when I was a kid. And then when I hit, so, it didn't happen right away at 9, but by the time, so I started puberty around 9, and I would say I was mostly through, the major stuff by 12 or 13. And by that point, I had about 50% as much hair as I had when I was 7 and 8.
Yes. And the fact that you started puberty at 9 speaks volumes to your metabolic health at that time. And any doctor woke to metabolism, insulin, and thyroid would have immediately said, this girl's in puberty at 9. There's something going wrong with the metabolism. We got to look into this deeply. But now that was not on the radar back in the 90s. Now that you can give the doctors a pass for that. Yeah.
I wore a size 36C bra by the time I graduated from 4th grade.
Wow. Yeah.
So
and that also, I mean, the women listening can just imagine the consequences of a 4th grader with that kind of development. I mean, because you don't want that in 4th grade at all. You want that in 9th grade, of course, 10th grade, but not in 4th grade.
Yeah. And it was weird. I mean, not to just be there. Apparently the show was not supposed to be about Kim's childhood, but apparently it is. But it was weird because you know how little kids have that kid belly kind of sticks out?
Yep.
Well, because I looked like an adult with that kid belly, I was constantly being asked if I was pregnant.
Oh, man.
As a child.
Yeah.
Like, I was like, no, I'm 11.
Yeah.
Although now there are pregnant 11-year-olds.
Sure.
But
not back then.
But
it's very rare.
It was pretty rare back then. Yeah. But that was also sort of traumatizing.
Oh, I can imagine. But I think it's important to talk about. I think it's important for women and men to hear this, that it's because so many people with hypothyroidism, they kind of don't talk about this stuff. And I'm so glad you've talked about this because it's going to be so helpful to people to know, oh my God, it's not just me who went through the shit of all this. Yeah, but there's hope on the other side of this, regardless of the age that you finally figured out what it was. Even if some of the listeners haven't yet been diagnosed with hypothyroidism, it's 100% not too late to have a wonderful life and to have deep and meaningful happiness and relationships and all that stuff that you've always wanted your entire life. That stuff's still out there. You can still have that regardless of what age you get diagnosed. But the important thing is that you get diagnosed so that you can know that's what it's been all this time.
Right. And I guess I want to put it out there because I think a lot of people might focus on the part of my story where I say like, oh, it was very expensive, but I saved a lot of money to see this fancy doctor. But the part kind of I didn't say, which was up until that point, I'd seen a lot of doctors.
Yeah,
right.
I imagine.
You can't give up and you can't accept no for an answer. I think is really important. I was like, I'm going to keep searching until I find somebody that's going to not give me the answer I want, but keep digging until we get the right answer.
Yes. An answer that at least responds to medication.
Right.
Yeah.
Right. Yeah. So, and while I know not everybody has a ton of money to spend, it doesn't always cost a ton of money.
Yeah.
But there's an old adage, it's kind of like you can spend time or money. If you don't have the money to spend, you're probably going to have to spend the time.
Yes. And let's be very blunt here. You should not have had to have saved up your birthday money to see Dr. Gottfried. That should not have been a requirement for you to be properly diagnosed.
Right. These are not expensive tests.
That's exactly right. These are tests that if you pay cash for them, they cost $10, $20, $30, $40, maybe $50. So you should have gotten to spend your birthday money on what you wanted for your birthday, not a doctor's visit.
Right.
Yeah.
Right. And so I guess I wanted to put out to people listening that good news is that we actually, back in that day, I didn't know. I had no way of knowing what a thyroid panel should look like. But that information is actually out now.
Right. People have social media now. They can do their own research. They can go to pubmed.gov. They can watch YouTube videos. They can listen to your podcast. And whereas back in the early 90s, you were screwed. Who were you going to ask? You could go to the medical library in the city and sit and do 2 months of research and maybe have figured this out. But now people have access to literally a PhD's worth of information about thyroid. If they've got the time and the inclination, something's wrong with me, and no doctor seems to know what it is. I'm going to go down this rabbit hole. I'm going to look into this hypothyroidism. I'm going to demand my doctor check this full thyroid panel, which we'll name the actual test. And then I'm going to give you a little ninja level strategy tip towards the end of this podcast of how, even if your doctor says no, I'm not going to check those tests. I wouldn't even know how to interpret them. They're going to cost too much. Insurance won't pay for them. All the excuses doctors make to say, no, I'm not going to check that. I'm going to tell you a secret strategy that you can use on your doctor that will get them to check any test you want them to check, including a full thyroid panel.
All right. That sounds like a plan.
All right. So do you want to talk about what tests in order to completely and thoroughly check your thyroid?
Sure. So I used to recommend a few more tests, and then, in talking with you, realized that there's a real central set of tests that matter, and you can get what you need to get out of those. Yeah.
So to be honest, if you got down the LabCorp manual or the Quest manual, there's probably 200 tests that in some way tests the thyroid or some thyroid hormone or some thyroid antibody, but you don't have to have all 200 tests, which would probably cost $100,000 to get all those tests checked. But over the years, I and others, it's not just me, there are many other doctors like Dr. Gottfried who are woke to this, who understand thyroid function enough that we can whittle it down to a handful of tests that are going to give you the answer 99.9% of the time. And I know you know them by heart.
I do.
So what are they?
It's the TSH.
Yep.
Because as we said, the TSH isn't enough, but it's good to have on the list.
Yes.
So you got the TSH, the free T4,
yes,
the free T3,
yes,
the reverse T3.
Very important. And often neglected by many doctors, but a reverse T3 is mandatory. If you have Google symptoms of low thyroid, if you have more than 3 of those symptoms, you need this full panel checked.
Right. And then it's a good idea, at least at some point, to get your antibodies checked.
Yes.
Because the number one cause of hypothyroidism seems to be Hashimoto's or an autoimmune issue.
And there are many antibody autoimmune tests to check for the thyroid, but the 2 most important ones that are going to give you the answer almost every time are TPO antibody and a TG antibody. So a thyroglobulin antibody and a thyroid peroxidase antibody.
Now, I have a question that people might have,
sure,
which is, so the first list of tests that the TSH, free T4, free T3, reverse T3, that'll tell you whether or not you have hypo or hyperthyroidism.
Yes, that is exactly right. But many people with Hashimoto's thyroiditis can have severe symptoms of hypothyroidism, but still that first panel of labs looks normal. That's right. Okay. For a few years now. It won't stay normal after years of Hashimoto's. Right. Eventually, even those numbers will start to be abnormal.
Got it. So you want to know if you're, because with an autoimmune condition that affects your thyroid, it's like actively attacking
your body is actively attacking your master gland.
Right.
That's
so you
right.
need to know if your body's producing those antibodies because you need to stop that process to retain as much thyroid function as possible.
Well said. And that's exactly why you want to know, if I could go back in time, I would have checked those antibody tests on you as a 9-year-old. Because even as a 9-year-old, you hinted at it earlier, your tests might have been normal. But I guarantee you, your antibodies would have already been elevated. Your body was already attacking your thyroid. But your TSH and free T4 may well have been normal or just a little bit out of the normal limit, not enough to freak your doctor out. And so they're like, well, no, I don't think she has hypothyroidism. But if you had checked a TPO antibody and a TG antibody when you were 9, 10, 11, boom, you've got Hashimoto's. And then immediately, hypothyroidism would have been on every doctor's mind that saw you in the next 28 years. And so that would have made them much more capable of helping you.
Right.
Because they wouldn't have been in the dark. Because all your doctors were just as much in the dark as you were.
Right. Yeah, we were all just operating from assumptions and guesstimates.
Yes.
Because we didn't have the correct diagnosis.
Yeah, exactly right. Yeah. And so that's the panel of labs that you absolutely need to respectfully, lovingly demand from your doctor: a TSH, a free T4, a free T3, a reverse T3, a TPO antibody, and a TG antibody. And as I said earlier, there are many other tests for the thyroid, but those are the most mandatory tests to tease out, do you have a low thyroid condition, and do you have an autoimmune condition that is attacking your master gland?
So this is an interesting point, which I heard from a client, and I was confused. But she said, oh, my doctor says my thyroid's fine. And I said, what labs did they check? And she said, they didn't check any labs. They felt my thyroid.
Yeah.
What's that about?
Okay, so the physical exam is important. Because you can a good doctor can see a goiter, which is a swollen thyroid, across the restaurant. Like I said earlier, a great doctor can see a goiter across the room. A good doctor can examine your thyroid with a bimanual exam using both hands.
Your throat, right?
Typically, in order to do it properly, they need to stand behind you. With both hands and then palpate your thyroid gland. This requires an adjustment of the doctor's body position and an adjustment of your position. Some doctors are lazy and they don't want to go to all that trouble. So a lot of doctors will just do this right with one hand, and that is inadequate to detect a thyroid nodule or a subtle goiter or an asymmetrical goiter. You have to have the same fingers from both hands from behind the patient palpating the thyroid to pick those things up. And so many doctors are busy or lazy or some combination, and they just don't do that. But in no way is it appropriate to say, well, I examined your thyroid and your thyroid is fine. That borders on malpractice.
Because I would also imagine that unless you've been palpating somebody's thyroid on a daily basis for several years, there's probably some genetic variation between people, bioindividuality.
Exactly. And you can have severe hypothyroidism and have a palpably normal feeling thyroid gland. Mm-hmm. Having a goiter or a nodule is not required to have hypothyroidism. So the physical exam of your thyroid could be 100% normal, and you still have severe Hashimoto's or severe hypothyroidism or both.
Right.
So, that patient was egregiously mismanaged if her doctor literally said that to her.
Right. Okay. Because I was like, because I certainly have heard about people having like thyroid cancer or goiters, but that doesn't seem to be the most common manifestation.
Exactly. Those are rare things, to have a thyroid nodule or to have thyroid cancer that you can palpate and feel through the skin. But as we both know, hypothyroidism is far too common. And so for a doctor to think that they can diagnose hypothyroidism with a bimanual exam that's foolish. I mean, that's something that a college student would say, not a MD.
Well, apparently.
Yeah.
So now I'm on natural desiccated thyroid hormone.
Excellent.
Keeps me really very well regulated. I do hear a lot of discussion about a lot of doctors will only put people on Synthroid.
Yeah. So Synthroid is levothyroxine, and it is fake T4. The reason that doctors are so in love with Synthroid is that back in the 90s and early 2000s, Synthroid had just become an FDA-approved branded medication. And I can remember when I was in residency in Memphis, I bet we had 400 boxes of every dose of Synthroid. That's back when it was on label. There was no generic levothyroxine then. And so, I mean, I'm not joking. There was 200, 300 boxes of Synthroid in the sample closet because they wanted everybody with hypothyroidism to be on Synthroid because that way they could make billions of dollars. Right? So they also, at the same time, the company that marketed Synthroid initiated a smear campaign against the desiccated thyroids.
Which is what everybody took before.
Which is what everybody took, Armor or something like that. Either it might have been compounded by their local pharmacist, but it was a desiccated thyroid, which had not only T4, it had real T4 in it, but it had T0, T1, T3, T2, T3, and T4. It had all that, plus calcitonin. So they got a full thyroid replacement hormone, not just fake T4.
Right, because you mentioned earlier when we were talking about my diagnosis that my T4 wasn't horrible, but it was really my T3 that was a problem.
Exactly, right. And so you're one of those people who makes lots of you inappropriately route your T4 to reverse T3 instead of real active T3. And so if you'd been taking a desiccated thyroid hormone, you would be getting real T3 in that pill, and that's what you're on now. And I assume that Gottfried, she started you out from the day one.
Yeah.
But there are hundreds of thousands of people out there who are on Synthroid or levothyroxine who say, well, yes, I feel a little better, like you were saying earlier, but I don't really feel great. And that's because for many, many people, fake T4 just doesn't cut it. It doesn't give you everything you need. Your body's not able to use it because it's a patented molecule, which means by definition, it is not exactly the same as real T4. It has to be chemically different. It has to have a different shape. It has to have extra atoms attached to it in order to be able to get a patent. So therefore, they're not taking real T4, which is what their thyroid wants. And for some people, it works tolerably well. For other people, fake T4, Synthroid, doesn't help them at all.
It's pretty rare that I hear people say, I tried a natural desiccated, but I prefer the Synthroid.
Yeah, very rare. But many doctors prefer it because that's what they were trained to prescribe. Mm-hmm. That's what they've been managing for years. And they've never prescribed or managed desiccated thyroid, so they're uncomfortable with it.
And they've heard rumors.
And they've heard rumors that I intimated earlier. The Synthroid company literally hired a PR firm to smear desiccated thyroid.
Because I still hear that from clients.
You hear the echo of that from what? 30 years ago now?
Yeah, my doctor says those are unreliable.
Exactly. And so back in the 80s or 90s, I forget, when the smear campaign hit, they did some testing, and there was too much fluctuation in the actual dosage. That was immediately corrected. And that's constantly monitored.
Right.
Today.
Yeah, I was saying the other day that there was a recent recall on a natural desiccated. I always hear recall. I think, there was some pollutant or no, it was literally they were like 2% below their threshold for efficacy. Like it has to contain X amount, and they were 2% below the threshold.
And the company did a Recall.
Exactly. The company said we're taking this off until we fix that problem.
Exactly.
I mean, that is such a small margin that they're managing.
Absolutely. And so every desiccated thyroid company does they routine checks on the efficacy and the potency of their drug. And if it's the least bit high or low, they're going to recall that and they're going to fix it. So everybody should, if your doctor says, oh, desiccated thyroid's not reliable, the dosage is not consistent, your doctor is repeating a rumor that they heard 30 years ago, literally. That's how far behind they are.
Right. And so, but I think a lot of doctors who are just managing to the numbers and not managing to the person and the symptoms, they're in a feedback loop.
Yes.
Because they only order the T4 and the TSH.
Yep.
And if you give somebody Synthroid, it'll fix the T4 and the TSH.
That's right.
But it's like not actually fixing.
But it doesn't fix all the symptoms, and that's why there's so many people out there with a diagnosis of hypothyroidism who also have a diagnosis of depression, and they're on an antidepressant because the fake T4 is not doing the job that it should be doing.
Right.
Yeah, and so they're carrying an extra diagnosis that they shouldn't even have to carry, and taking an extra pill, paying an extra copay, taking a chance on having bad side effects, possibly.
And accepting a life that is suboptimal.
And accepting a suboptimal life and probably blaming at least some of it on themselves.
Right.
Yeah. So you ready for my ninja trick on how to get the labs?
What's your ninja trick?
Okay. So you go to your doctor after you've done your own research and you've looked up the symptoms of low thyroid, and you've like, oh my God, I've got 3, 4, 5, 6, 7, 8, all of these symptoms. I've got all of them. I've got a lot of these symptoms. You say, Doc, I want you to check my thyroid. And if they walk over and feel your thyroid and say, it feels fine, say, well, thank you, doctor, for that. But what I would really like you to do is to check the following labs. And you're going to have this written down. And it's going to be the labs Kim and I talked about earlier. And if your doctor says, what's a very common thing a doctor might say if a patient hands them a list of labs that they want checked for their thyroid?
Well, they probably say, well, this seems an unnecessary list. I usually find that TSH and T4 is sufficient.
Yeah, that's exactly right. That's probably the most common answer. Some docs will say your insurance won't pay for these labs. Some docs will be honest and say, well, I wouldn't even know how to interpret these labs if I ordered them. Some docs will say, well, it's not going to change my management anyway, because either way I'm going to give you Synthroid, which is true for that doctor because that's the only thing they feel comfortable with. So what you're going to do is you're going to say, okay, doctor, I understand, but I want you to check this full panel of labs for me. And if they again refuse, you're going to say, okay, doctor, I am afraid that I have low thyroid, hypothyroidism, which can literally cause heart failure. Because I read that. Is that true? And your doctor will begrudgingly say, well, yes, in severe cases, untreated cases, it could. And you'll say, well, if I have it and you haven't diagnosed it, then it's untreated, right? And I could wind up having heart failure because of my undiagnosed thyroid condition, to which your doctor will probably start to get flustered at that point. And then you're going to say the following, and this is the ninja level trick. You're going to say, Doc, I understand. I need you to document in my permanent medical record that the following. I'm afraid that I have undiagnosed hypothyroidism or inadequately treated hypothyroidism, and that I gave you the list of labs I wanted checked, that I gleaned this lab from numerous experts in the field. I've read books about thyroid. I've watched YouTube videos, and that you refused to order these labs, even though I'm afraid I have inadequately treated low thyroid. I want you to document that in your permanent medical record, and then have your nurse print me off a copy, and I want to take that with me. Now, can anybody feel the tension in the room when you say that? And say it with a smile. Say it respectfully. Don't be an ass about it. You don't have to be, because these words are going to carry more weight than you realize with your doctor. Because what your doctor immediately hears when they hear a patient saying, would you document that in my permanent medical record and then print me out a copy, they hear malpractice.
Right.
That's what they hear.
They hear lawsuit.
They hear lawsuit. They hear lawyers. They hear depositions. They hear medical boards, and they don't want any of that. Doctors are very risk averse. They don't want any drama. They don't want any of that. And so 9 out of 10 doctors will say, Fine. Give me the list. We'll order your tests. They're not going to help anything. They're not going to blah, 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 but we'll order your tests. And then you say, thank you very much for understanding. And you're very polite and you say, thank you, because your doctor potentially just saved your quality of life and added years to your life by checking these tests. And then 1 out of 10, maybe 1 out of 20 will just kick you out of their office at that point. And that's actually a good thing, because if your doctor refuses to order the labs at that point, that's a huge red flag that they don't give a damn about anything.
Right.
And so you need to find a new doctor. If after that statement they don't order those labs, you need to worry about that doctor and you need to find a new one.
Because perhaps the thyroid issue is not even the beginning of the problem.
Exactly. Maybe the doctor has undiagnosed problems of their own that you don't know about. You probably need a new doctor at that point.
Right. Yeah. Another thing I will say, and I wouldn't have thought of this, but I've learned this from some of my clients. There are a lot of doctors that will say, fine, okay, no problem, pick up the lab slip from my nurse, or we'll call it into the system, whatever. And then they go to get their blood drawn, then they get their labs back, and the labs aren't on there.
And they didn't order what you asked for.
Exactly.
And then at that moment, you pick up the phone and you very respectfully make another appointment, and you go to that appointment and you say, Doc, did you document in my permanent medical record that I asked for these tests and that you refused to order them because you didn't order them? So do I need to pick up all my medical records and find a new doctor, or are you going to order these tests? Because I really like you as a doctor and I'd like to keep you, but these tests are not optional. I need these tests ordered. Are you going to do it or not? And at that point, you will discover that you've either made a deep, meaningful connection with your doctor for life, or you need a new doctor.
Right. You need to know if your doctor's a fixer-upper or a dumper.
Do you need to dump them, or are they a fixer-upper? That's right.
Right.
Yep.
Yeah. Well, that's amazing. That is some ninja moves.
Yeah. And yes, you are going to make your doctor uncomfortable. Yes, you might be uncomfortable. But think back on Kim's story. What if her mom had heard this podcast before Kim went for her 9-year-old checkup, and her mom had presented that list to the doctor with that ninja trick and said, please, doctor, we love you and we respect you. We want to keep you as a pediatrician until Kim's 18 or 21. We love you. Please check these tests. How Kim's life would have been different. And so it's worth that little moment of uncomfortableness to redirect the ship of your life back into the right track. It is that important for you to go through that little bit of tension,
Oh, and I'm
drama,
conflict averse.
Yeah, I know. Yeah. But sometimes in order to get what we deserve, and we all deserve optimal health, and we all deserve a proper diagnosis, and we all deserve not to be wrongly diagnosed. We deserve that, I think.
I absolutely agree. And I would rather know sooner than later that I needed to start looking for a new doctor.
Yes.
When my doctor
yes. Oh, yes. And you want to know as soon as possible if your master gland is malfunctioning.
Yeah.
Or inadequately functioning. The sooner you know that, the less the likelihood that you go through the rest of your life with fewer hair follicles on your head than you deserve.
Right. Or infertility.
Yes, infertility.
All sorts. I mean, just like because it is that master gland, right? Every part of who you are is affected.
And mental health is affected? Obviously, you had severe depression symptoms.
Yeah.
Yes. And probably even to this day, although now you're happy and ebullient, I know that there are still days when you've got a negative outlook.
Yeah. I think that, it's a question like which came first, the chicken or the egg.
Yep.
But when you spend decades living a life where you sort of like wear ruts in the road of depression, it's real easy to fall back into that rut.
Sure.
Because that road isn't smooth anymore.
Well, that's your road.
Yeah.
But it shouldn't have been your road.
Right.
But it was.
Right.
Yeah. And so I think that the information, and thank you for sharing all that. I know you weren't prepared for that. I know you weren't prepared for that, but I think it's so important that you shared that for people to understand. This is big time important. This is not just like, oh, I thought I had a hangnail, but the doctor said it wasn't a hangnail. This is life-changing stuff. This is life-altering stuff. And so if anybody knows somebody who's got a list of these symptoms, they need to know these tests. They need to know my ninja level trick to get the test checked. Whoever's listening to this needs to share this. If they've got a family member or a loved one or a friend who has these symptoms, they need to know this information.
Right. And, we talked about today, me and my thyroid. We'll just call the episode
Me and my thyroid.
But it's not just the thyroid.
Right.
That this kind of story could be applied to. Maybe, different details, but there are all sorts of important tests that can be run. That's why we run a blood test, right? Like, you might wonder, like, why do we run all these blood tests? It's like, because there are things you can tell in the blood that you can't yet tell. Well, hopefully, right? They haven't manifested yet.
That's right.
Or if they have manifested, maybe it's in a confusing way. Or it could be a number of things.
Yes.
And we need very specific sets of blood tests to identify, like, it's like why my check engine light came on, but we have no idea why the check engine light came on because it's very non-specific.
Must be depression. Here's a pill.
Exactly. So in a way, you need at least a minimum effective survey of blood labs to identify what is wrong.
And it's not your fault as the patient that your doctor doesn't know about these labs, but it 100% is your problem. And it will be your suffering, and it will be you taking the unnecessary pills, and it will be you suffering with symptoms for years to decades, not knowing what's wrong with you and why this doesn't work right, why this doesn't work right, if your doctor doesn't know which labs to check for specific situations.
Right. Yeah, I could have very easily lived my whole life.
Yep.
And many people do live their whole lives accepting a subpar life.
Yes.
Because it's the best they think they can have.
Yeah. And when you're already diagnosed with depression and bipolar, and your weight won't behave, your hair won't behave, your skin won't behave, your mood won't behave. I think we all know what choice or decision starts to be on the table at some point when your life just sucks like that daily for years and years and years. People start to contemplate, why am I even here? Why am I going to just live this miserable existence? And that's a thought that no one should ever have to have.
Right. There was a point, I would say, about the time I got diagnosed where I would not say I was actively suicidal, but I really didn't care if I got taken out by a bus.
Right.
I literally was worried about the guilt of actually actively doing something to end my life. But if it accidentally happened, I wasn't really all that concerned.
It was on the menu.
Exactly.
And it shouldn't be on the menu.
Right.
But it was because of what happened when you were 9 years old. And I think it's very important for everybody to understand that nobody at that 9-year visit and subsequently, there was no one who was evil. No one who was bad, no one who was just terrible or a loser or any of that. All this was done for all these years with the best of intentions.
Right.
And Kim is the one who suffered.
Yeah. And I know this is many of people who are listening right now. I know this story is change the hair color and the shoe size, and it's somebody else's story.
That's right.
And it happens to so many of us in so many different areas. And I'm just so grateful that we live in a time where we have access to so much better information that we don't have to stay in the just living with, I guess this is as good as it gets.
Right. Because there's always hope. There's always an answer if you dig deep enough, look for long enough, see enough doctors,
right?
Maybe save up your birthday money to go see that special doctor who doesn't take insurance. But there's always hope that you are not at the end of your rope. You have not exhausted all of your options. I promise you, there is an answer. You got to keep looking. You got to keep digging. You can't give up. You got to keep looking.
Absolutely. And I will say, which is, surprising, but, it's hard to think about it as terms of investment, but I have more than made back any money I've ever spent on that proper diagnosis from having a functional life.
That was a well-made investment.
Well-made investment of birthday money.
Yep.
Yeah, absolutely. And so I kind of come back to what we were going to talk about on today's podcast, but we went on a journey. Was that the reason that I'm here right now is Dr. Bear and I are working on a new version of our labs book. And this story is why it's so meaningful to both of us. This lived experience of how life-changing appropriate lab numbers could be.
Absolutely. And this applies to many different diagnoses that can be missed if your doctor doesn't understand human physiology. And I know just saying that out loud, that sounds like, what? All doctors understand human physiology. You'd be surprised. You'd be surprised how many doctors have gotten very comfortable with their prescription pad and their little algorithms that's just what they do. That's how I practice medicine. And they don't watch YouTube videos, and they don't read the latest research, and they don't do any of this stuff. They never look outside their little box. They just get out their prescription pad and write the same prescription that they write 20 times a day, and that's what they do. And you actually are going to do your doctor a service and all your doctor's other patients a service by asking for the labs that you actually need to be properly diagnosed. So you're not misdiagnosed, but also so a diagnosis is not missed. And that's the reason that we're doing the lab book, is so that you know which labs dig deep enough without breaking the bank. Because none of these labs are going to cost you all your birthday money. Okay, they're relatively inexpensive, and you can get these labs checked by either asking your doctor, or there are actually some internet companies now that you can go to who will they'll do any lab you want.
Right. There are a few states where you can't do it, but almost every state in the United States anyway, you can order your own labs and get them just all delivered to you.
Without a doctor's order.
Without a doctor's order.
That's right. Yeah. And I know New York, you can't do that.
It's like I'm going to get some wrong, but it's like 4 in the upper
the New England states
area, and then maybe Hawaii. But there are just a few states where you can't, but there are ways you can work around that potentially.
Yeah.
And there are also now plenty of doctors that do telehealth.
Yes.
And so where there's a will, there's a way.
Absolutely.
To get somebody on your team who's going to be able to help you get what you need.
And I promise you, even if you do have to spend a little bit of your birthday money, it's going to be worth it in the quality of life improvement that you experience, and by the extra years of quality life that you tack on to your life. And you're going to take that option off the menu that you've been thinking, well, it wouldn't be so bad if I got hit by a bus, because this kind of sucks, this life I'm living. That shouldn't be on the menu, and this is one way you can take that off the menu.
Absolutely. So thank you guys for joining us on this unexpected journey today. And if you want information about our upcoming labs book, we will have, by the time we put this episode out, we'll hold on to it until it's ready. So by the time this episode is out, there will be a link in the show notes so that you can get information on that lab book, because we feel like it's really important not just that you get a list of all the labs that you should be getting so that you can compare it to the list your doctor thinks you should be getting, but also kind of at least a baseline understanding of what those labs are.
Of the why. Why do I need that lab?
What is that test?
Yeah. Because I hear very often people tell me, well, once I explain to my doctor why, they're like, oh. And some have actually been like, oh, I didn't know that. They actually admitted to the patient, oh, I didn't know that. Okay, yeah, we'll check that.
Right. Yeah, I hear that about the C-peptide.
Yep, exactly.
People are like, well, why would I get that one? And then you're like, oh, because it tests this and that. And they're like, oh, yeah, that makes sense.
Oh, well, I'll start checking that on everybody.
Yeah, exactly.
And then you just help every patient that doctor sees.
Absolutely. Yeah. So thank you guys for joining us today. I had a good time talking with my good friend, Dr. Barry. And
sorry I made you cry.
It's okay. It's okay. It's good. It's good. I'm an easy crier, really, honestly. So,
I don't believe that.
You don't think
so?
No,
I don't think so.
You haven't seen me watching movies. Anyway.
I hear you.
All right,
well,
guys.
Thanks so much for coming to visit and for chatting today. This has been, I think this is very important. This information that you shared today is very important, and it was a pleasure to talk to you.
It was a pleasure to talk to you as well. All right. Bye-bye, everybody.
Thank you so much for joining us for this episode of Keto Life Support. Want more information? Want show notes? Want to suggest a topic? Just head over to ketolifesupport.com. That's where all that kind of thing can go on. By the way, I have a request. If you could go to your podcast host and hit subscribe, we would really, really appreciate it. And what would be even more awesome is if you could write a review. And what would be even more awesome than that is if you could write like a really flattering review. Just asking, you do you.